Hello, welcome to the chapter on articulations. The main student learning outcomes in the chapter is to understand the importance of joints, how they are classified. There are two main ways to classify them: the functional classification and structural classification. We learn about the most common joint in our body, which is the synovial joint, the accessory structures and their function. We'll also study the structure and function of some of the main joints in our body, like the vertebral joints, your shoulder, elbow, hip, and knee joints. We'll also define the different type of body movements and identify the joints that allow all these body movements. When we say articulate, it means to join. So, an articulation is where two bones come together, adjacent bones or bone and a cartilage, they come together to form a connection. And body movement occurs at these joints where the two bones connect. We have about 360 joints in the human body. The joint structure, how they come together and how they articulate and how they are held together, will determine the direction and the distance of movement. It's also called the range of motion, or ROM. In general, if a joint has a lot of mobility, then its stability will decrease. There are two ways to classify joints. Classified according to the range of motion, it's called as the functional classification. If a joint cannot move, it's called Synarthrosis. Amphiarthrosis is slightly movable joint, and Diarthrosis is freely movable joint. The next classification is depending on the type of tissue that's holding the two bones together. It can be a bony fusion, or it can be fibrous connective tissue, it can be cartilaginous tissue, or it can be a thick viscous joint fluid called synovial fluid. And under each one of these structural classification, you can plug in the functional attributes to it. So we'll look at each one of the joints under the different classification types. So synarthrosis, meaning no movement. So two bones are coming together. A good example is the sutures that you'll find in your skull, cranium. They are held together, or it looks like somebody sewed it together with fibrous connective tissue. So they are called sutures, dense fibrous connective tissue. It is not movable. Another synarthrotic joint where uh, the bone anchors into the periodontal cavity in your mandible and your maxilla is held together by dense fibrous connective tissue. So that is called gomphoses. When cartilage is holding the bones together, it's called synchondrosis. Chondro means cartilage. So here's an example of the ribs connecting with the sternum, synchondrosis. A bony fusion, where the bones are connected by a bridge of bone, is called synostosis. So here you can see the frontal bone is actually the fusion of two bones, synostosis. Amphiarthrosis is giving very little movement. Amphi, uh, it's like in between. When the structure that is holding them together is fibrous connective tissue, it is called syndesmosis. And here's an example of the distant articulation between tibia and fibula. It can be cartilaginous, like you see in the symphysis the pubic symphysis between the coxal bones. And in diarthrotic, it's the freely movable joint. It can either move in one plane, it's called monoaxial, two axis is bi, three is tri. So we will spend a lot of time on the synovial joint. The two bones are connected by a joint capsule, and there'll be synovial fluid. And this is the freely movable diarthritic joint. So we look at each one of these joints in more detail. The first one is synarthrotic joint. These joints are very, very strong. There is no movement. It looks like all the bones are interlocking like a zigzag puzzle. So this coronal suture is like locking the two bones together. So less movement. So there's no movement. So it's very strong. So in a suture, the bones are interlocked. They are held together by dense fibrous connective tissue. And a very good example is the skull. And goamphosis is the connection made by fibrous connective tissue that anchors the teeth in the periodontal cavity in the alveolar process. It's called periodontal ligament. So this type of immovable joint is called goamphosis. Synchondrosis is a cartilaginous bridge between two bones. The epiphyseal cartilage of long bones and also between the sternum and the vertebral ribs are synchondrosis. Synostosis is the fused bones or immovable joints. In amphiarthrosis, amphi means in between. It is not fully movable or it is not immovable. It's in between both. It's slightly movable. So, two good examples would be the syndesmosis, where bones are connected by ligament, and symphysis. So, there's a pubic symphysis. So, there is very slight movement here. So, these movements are more stronger than a freely movable joint. So, they are called amphiarthroses. So the connection between slight movement between the radius and the ulna or the tibia and the fibula, very slight movement, they come under amphiarthrosis. And this is the most important joint that we'll be focusing on. Synovial joints are the highly movable joints. They are called diarthrotic joints. So here is a general a picture of a synovial joint. They're mainly found at the ends of long bones, and the two articulating bones, they are bound together by a articular capsule or joint capsule, and they are lined by a special membrane shown in pink here called synovial membrane. So these membrane are specialized to make synovial fluid, actually from blood plasma. So it's a thick viscous fluid. And here you can see a long bone, the compact bone and the spongy bone. You can even see the epiphyseal line, and then you can see the ends of the long bones are protected by the articular cartilage. It's for protection so that they don't rub against each other. It's usually hyaline cartilage, and they will reduce friction and they will protect the ends of the long bones. The synovial fluid that's made by the synovial membrane, it is rich in proteins, and like it's called proteoglycans. It is secreted by fibroblast, and main function is lubrication, joint lubrication, to reduce friction. And it will also make sure there's even distribution of nutrients. It's nourishing the joint, and it plays a huge role in shock absorption. So this is a generic structure of a synovial joint. So some of the other features that are found in a synovial joint would be cartilage. So this is the articulating cartilage, which is the hyaline cartilage. You might see fat. See, there's a fat pad here for insulation and protection. It will protect. And the whole joint capsule is made by ligaments. They will support and they will strengthen the joint. So these two bones are held together and kept in place with ligaments. There might be tendons that connect a muscle for muscle attachment. There can be something called bursa. Bursae is plural. So it's a little cushion filled with synovial membrane and it has synovial fluid. So these pockets of synovial fluid will make sure that the ligaments don't rub against nerves. So it's like it has a cushioning effect. When this is infected or inflamed, we've heard of bursitis. Some of the other things that you can see here in this joint, there is a fibrocartilage pad called meniscus. Menisci would be plural. So again, this is to reduce friction also. And some of the injuries that can happen at the joints here. See here, this is your shoulder joint, and you can see how the head of the femur has popped out of the glenoid cavity. So this dislocation is also called luxation, where the articulation is forced out of position. A partial dislocation is called as a subluxation. Another common injury in the joints would be ligaments that are torn. This tearing of collagen fibers, and we would call that a sprain. So, this picture is a picture that shows the basic elements that you will find in all the synovial joints in your body: the joint capsule, the articulating surface, menisci, bursa, fat pads, synovial membrane, and synovial fluid are the main components. It's held together in place by ligaments. So, this picture is showing another way to explain joints depending on the type of movement and the direction of the movement. So, this is in pertaining to synovial joints. So, you can define the joints by the type of dynamic motion it can bring about. It can be a linear movement, like here. So, linear, that means gliding along a straight line in one direction. See, north, south, or east, west. It's just gliding in a straight line. Angular movement are produced when the angle between the bones, articulating bones, changes. So, the angle is changing. So, it's called angular movement. When it rotates on its longitudinal axis, it's called as a rotational movement. If it can move in one plane, it's called monoaxial. Two planes, two biaxial. If it can move in three axes, it is triaxial. So all these are called the dynamic motion of the joints. So classification of synovial joints depending on the shape of the articulating surfaces and the amount of movement it allows. So, for example, if you take the pivot joint, see here in your cervix between the C1 and C2, between your atlas and axis is a pivot joint. This allows for rotation in one axis, monoaxial. So, you are able to nod your head. Hinge joint, a good example is your elbow. It works just like your door hinge. You open and close. So here you can see a concave surface is articulating is in a convex surface. The saddle joint here, example is between the trapezium carpal bone and the first metacarpal bone here. So here you can see again the articulating surfaces. It looks like a saddle, and it fits into a curved process in the bone. Plane joint. Good example is between the tarsal bones of your foot. Here, the articulating surfaces are almost flat or maybe very slightly curved. So it offers gliding motion. A condyloid joint, the radiocarpal joint in your wrist, it is biaxial. So one bone will have an oval articulating surface and the other bone will have a depression to fit it. So that is a condyloid joint. The ball and socket joint. One bone will have a ball process in it, and the other bone will have a socket. So they fit like a puzzle piece, a ball and a socket. These can be found in your shoulder, in your hip. So they are triaxial, they allow for a lot of movement. So synovial joints that have all the features of the synovial uh, the characteristics of the synovial joint, like the synovial membrane, the joint cavity, the articulating surface, bursa, and fat pads, they are classified depending on the shape of the articulating surface and the amount of motion it allows. So, what type of movements can be brought about by all these joints? So, flexion and extension. So, flexion is an angular motion in anterior posterior plane by reducing the angle. So when your arms are extended and then you reduce that 1 degree angle into to less than 180 degrees, it is called flexing. You can do the same with your knee, uh, with your neck and your hip. So extension would be again angular motion in the anterior posterior plane by increasing the angle. If you go beyond the anatomical position, it will be called as a hyperextension. When you move your arms away from the midline of your body, it's called abduction. It's an angular motion in the frontal plane moving away. When you bring your arms back towards the midline of your body, you're adding it back. It's called adduction. A good way to remember abduction or away is when a child is abducted, taken away from the home. Abduction and adduction. Circumduction is a circular angular motion also. Here, the circular motion without rotation, it's circumduction. Rotation. So this is in reference to the anatomical position. It can either be a medial rotation, which would be a inward rotation, or lateral rotation, which would be a outward rotation. So these are all the different types of movements that can come about in the synovial joint. Flexion is reducing the angle to less than 180. When it's 180, it's an extension. So you can do flexion and extension in different parts of our body, in your hips, your neck, your knee. When you take your arms away, it's adduction. Bringing it together, it's adduction. There's more. There's pronation. So here, this is pronation. So this is rotating the forearm, radius over ulna. Supination would be the anatomical position. Inversion is when when you twist the sole of your feet medially. Eversion is when you twist your foot laterally. Dorsiflexion is when you point your toes towards the ceiling, dorsiflexion. Plantar flexion is like a ballerina when you point your toes, extending the ankle and pointing the toes. Opposition is when you cross your thumbs and bring your thumbs together, thumb and your fingers together. You can like fold your thumb over your palm and then touch one of your fingers. It's called opposition. The opposite of that is reposition. Protraction and retraction, like a good way to understand is when you stick out your jaw, is to move it anteriorly in the horizontal plane is a protraction. When you pull it back is retraction. Elevation is when you move your jaw in a superior direction, and when you drop your jaw, it's depression. That's why the doctor puts a tongue depressor when he or she wants to see your oral cavity. There's a very good video here that explains all these dynamic movements that are possible in synovial joints. Let's look at some of the most important synovial joints in our body. So this picture is showing the intervertebral synovial joint. So the vertebrae is held together by ligaments, lots of ligaments, and intervertebral discs. So the adjacent vertebrae will articulate between the superior and the inferior articular process. It is called facet joints or zygophysial joints. So here is an example of the atlanto-occipital joint. It's between the superior articulating process of the atlas and the occipital condyles. This joint will help to move the head up and down, like when you're shaking your head, yes. The next joint is the atlantoaxial joint. It is a pivot joint. This is a pivot joint. So this is between C1 and C2, the atlas and axis. So you can see how the dents of the axis will protrude through the circular arch of the atlas, and the whole thing is held tightly by a ligament. So this is the atlanto-occipital joint. Atlantoaxial joint. It's a type of pivot joint. So this will help you to nod your head no. And all the vertebrae are held together by ligaments, and they are separated by these discs that's also helping it to articulate. Some of the main ligaments that you can see here is the anterior longitudinal ligament that connects the anterior bodies, the posterior longitudinal ligaments that will connect the posterior bodies, ligamentum flavum that will connect the laminae of the vertebrae, intraspinous ligament will connect the spinous process, supraspinous will connect the tips of the spinous process C7 to the sacrum, and there's also ligamentum nuchae that will connect C7 up to the skull. It is continuous with the supraspinous ligament. So all these ligaments are keeping the vertebrae together, and also the intervertebral disc. There are two parts in the intervertebral disc. The outer tough layer of connective tissue is called annulus fibrosus. Annulus fibrosus. It's a very tough layer. Whereas the inside jelly-like matrix, its elastic gelatinous core, is called nucleus pulposus. So together they are tough and they act as a very good shock absorber between the vertebrae. Some of the injuries that can happen is slip disc, which is a bulge in the annulus fibrosus. It can invade the vertebral canal, or a herniated disc where the nucleus pulposus, the inside part, can break through the annulus fibrosus. It can cause a bulge and it can pinch nerves. Both of them are very painful. The next is the TM joint, temporomandibular joint, the joint between the temporal bone and the mandible. So during depression of the mandibular condyles will move forward and hinges downward as it travels from the mandibular fossa into the auricular tubercle. So again, this has articular surface. It will have a joint cavity. The main ligaments you can see here, there's a ligament called lateral ligament, sinomandibular ligament, and lateral pterygoid ligament, temporomandibular ligament. So all these ligaments are keeping the joint together. In the shoulder joint, so you can see the main articulation is between the glenoid cavity of the scapula and the head of the humerus. It is supported by skeletal muscles, tendons, ligaments. So the whole structure is held together by ligaments. It is a ball and socket. The head is the ball and the socket is the depression. It is a diarthrotic joint. It affords a range of movement. The main ligaments that you can see here are the glenohumeral ligament, coracoacromial ligament, coracoclavicular ligament, acromioclavicular ligament. So this is one of the joints with a range of motion. You can flex, you can extend, abduction, adduction, external or lateral rotation, and medial rotation, and circumduction. So the elbow joint is like a door hinge. It's a hinge joint. It's very stable. Again, held together with lots of ligaments. So this offers flexion and extension of your forearm. So some of the main ligaments that you can see the articular surface. You can see the synovial membrane. You can see the bursa. The main ligaments would be the ulnar and radial collateral ligaments. Annular ligament that supports the head of the radius at the proximal radio-ulnar joint. The proximal radio-ulnar joint connects the proximal ends of the radius and the ulna together. The circular head of the radius will articulate with the ring formed by the radial notch of the ulna with the annular ligament. So you can see the synovial membrane and the synovial cavity here. The hip joint or the coxal joint is a ball and socket joint. So the head of the femur has a ball. It fits into the acetabulum. The socket is called acetabulum in the coxal bone. It is a diarthrotic joint. It is multi-axial. It has a wide range of motion, held together with lots of ligaments. Some of the main ligaments, there are 3 extra capsular ligaments, and then there's also an internal ligament. It's called ligament of the head of the femur. So that is the intracapsular ligament. And the 3 external ligaments would be the iliofemoral, pubofemoral, and ischiofemoral ligaments. So you can see the synovial cavity, the synovial membrane, the articulating surface, and the whole joint capsule made with a lot of ligaments. So it offers a range of motion, ball and socket, diarthrotic joint. The next joint is a knee joint. It's a very large joint. Both your hip joint and knee joint are weight bearing. So the knee joint is going to transfer the weight from the femur to the tibia. So the 4 main ligaments in the knee joint is going to connect the femur with both the tibia and fibula and also the patella. So there are lots of ligaments. There are four main ligaments: the anterior cruciate ligament, called ACL, the posterior cruciate ligament, and there's a lateral or fibular ligament and medial or tibial ligament. And here in the joint, you can also see the meniscus, the fibrocartilage pad, the medial and lateral menisci. It is going to provide a lot of padding and support between the femoral condyles and the tibial condyles. So the two main articulations between the femur tibia is at the medial and lateral condyles, and one between patella and the patellar surface here. So all the components that you studied in a synovial joint can be found here: the fat pads, the bursa, the ligaments, the synovial cavity, and the synovial fluid. So to end, some of the main effects of degeneration of joints or the effects of aging. So here you can see a normal joint. So what happens is, over a period of time, osteoarthritis, you can see how the articulating surfaces are lost and the bones start to rub against each other, or the articulating surfaces can even corrode off, or there's some kind of a deposition like uric acid deposition. So rheumatism is pain and stiffness of the skeletal and muscular systems. Arthritis is a form of rheumatism that will damage the articulating surface of the synovial joint. Osteoarthritis is caused by wear and tear of the surfaces. It has a genetic background to it. It affects collagen formation. Rheumatoid arthritis is a inflammatory condition. It's an autoimmune disease caused by allergies and infection also. Gouty arthritis is when crystals of either uric acid or calcium will form, and they will accumulate within the synovial cavity, and that is a metabolic disorder. And these are the most important points in the chapter, and I hope that was helpful.